Dr. Gaur, thank you very, very much for joining us today as the Summit Chair for World Congress's 3rd Annual Leadership Summit on mHealth and the Vice President of Telehealth for United Health Group. We really appreciate your time and wanted to just ask you a few questions about your time here thus far, kind of what we've learned and how we see the mHealth market moving forward over the next few months and next few years. First, what was one of the most interesting or notable takeaways that you've heard at the session so far?
Well, thank you very much for giving me an opportunity to sort of summarize my views to you, Jenny. But I think the most takeaway for me is that the ability to bring multi-stakeholder. In my opening remark, I had said that in order for sustain and scaling, we need to bring multiple stakeholders, the patients, the caregiver, the providers, and the payers. And what was really interesting yesterday, we saw multiple stakeholders there. So we had a good session from the hospital system bringing it out. We had a good session from the technology providers who were saying what solutions they are developing. We had a presentation from the payer side, from Humana and others. So that is what I'm really excited about. The multi-stakeholders are talking, and then from this will become a common ground. How do we bring this moving forward?
And that's actually a great segue into my next question in terms of, given that mobile and wireless is truly expanding the continuum of care, well outside the hospital's walls, how can the industry ensure that physicians are continuing to get reimbursed for these ad hoc services that they're providing via their smartphones, mobile devices?
That's a very, very important question, is that physician, even yesterday we had an example, one of the presenter mentioned that they had an application, they had ad hoc video consult, but that is not a covered expenses, and in that case it's great. To me, that meant that yes, technology works, but it's not sustainable because there is no reimbursement. And also, the other part is the liability for the physician and accuracy of information and so forth. So in order for this to improve, there are multiple things happening. One needs to have enough of evidence, because the payers are interested in, whether it's a government or private payer, want to know if this service, this consultation, truly improving the health outcome and not necessarily increasing the cost. So to build that evidence, I think we heard some of it already, organizations like VA, Kaiser Permanente, and so forth, where they have physician and other healthcare provider on their salaries, right? So when they are giving electronic consultation, they're not looking at reimbursement because they are salaried physicians. Where we have the challenge is where fee-for-service physicians, they are saying, okay, I'm providing this, I'm potentially increasing my liability, I'm not getting reimbursed for it. And so I think the evidence coming from places like Kaiser and others, which will demonstrate that this is actually adding value in terms of quality of care and not necessarily adding the healthcare cost. So that's how I see it.
Sure. So that's kind of looking at the reimbursement structure as a potential consideration for physicians looking, whether to adopt or not. Do you feel that there are, what are the other reasons that you feel that physicians are not adopting as fast or a little bit hesitant to start utilizing these devices to truly deliver care?
So I think, as I had mentioned yesterday, physicians or other healthcare providers has to fit in their workflow. So for example, right now the government is giving incentive for them to adopt electronic medical records. And if you use some of the other application, if it's tied to one system and workflow, they will adopt it. But if mHealth related solution does only 10% of their patient population they're serving, then it becomes a burden, because 90% of the time they don't have the use of this application. And so that's one part, is the fitting in the workflow. And the second part is that still further clarification of the liability. There's a biggest fear. First part is I don't get paid for it. But second, equally important part is this creating a liability? If somebody's taking some information 10 o'clock at night, am I supposed to react, or take intervention, or am I creating a liability? So I think those are the two major issues, I think.
Sure. And in terms of a question about desktop virtualization, do you see iPads becoming kind of the new standard, or, as we've been hearing a lot about over the past few days, do you see native apps and natively grown devices being the new standard, or being something that physicians and hospital organizations are really going to start heavily investing time and money into?
So I think as the trend is, the care is getting decentralized, it's going away from the hospitals to the doctor's office to the communities. And so, yes, if the hospitals had it their way, they want to have fully controlled and just virtualized, but fully controlled in their part. But I believe over time it's going to become more decentralized, and there will be more native apps that has to come in to be able to provide, but then back-end connectivity to the hospital systems. And it will not be just only iPad, but I think Android and other applications will come as well. But the part is, there's a lot of movement now is trying to standardize and connectivity with EMR and health information exchange. That's how you will bring the back-end connectivity. But the native apps have much more user-friendliness, much more relevance, what they're trying to do. So that's what I think is going to be.
So almost a hybrid approach of each as we continue to move along, certainly looking at the connectivity issues, but also what's going to deliver the best care for my patient is also the best user experience for me.
That's how we're at it.
Great. Well, Dr. Gaur, thank you so much. I look forward to the rest of the time here, and we've enjoyed talking to you today.
Thank you so much.
Thanks.
Thank you. Bye.